All right, hello. Thank you for returning to the We Will Expose the Wrongdoer show. All right, let's get on into it. So we just want to let you know that ding, 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 you win, wrongdoer. You win today. Yeah, we want to let everybody in the universe know that Southeast Mental Health at 16 West Long Street, Columbus, Ohio 43215 is not out here serving the community. They're not serving the community. Like they keep on telling these people, they give them the grants and stuff like that. Yeah, they keep applying for those $1 million grants and everything like that, and doing all this and that and the other, and they acting like we love the vulnerable populations, we love the disadvantaged. We're going to do everything we can to make sure that we optimize their health outcomes, and we're going to promote health and wellness, and yeah, we're going to reduce risk of complications, and we're going to link them with community resources and supportive things and everything out in the community. We're going to educate. We love the mental health population. These are liars, okay? These are liars, okay? Let's just get into that, okay? They got a whole medical director over there, okay, that is sitting up here trying to deny an actual disabled person access to the telehealth services that they offer, okay? So he's denying this disabled man, all right? Yeah, denying him access to telehealth services that are actually offered as an option to each and every consumer of the services there, right? Wonder why? Why? Why are you doing that, doctor? When, doctor, you know that this particular disabled man's been participating already in telehealth services since February of 2021, right? Now all of a sudden he can no longer do that. You need to see him face to face. You need to see him face to face. Oh, you need to see him face to face because we got to see what's going on with our patients because we care so much about our patients. We care about their well-being and all this type of bull, right? But yet, doctor, when you just went out of the country on vacation for 2 months, you didn't bit more care about this disabled man, did you? You didn't set up any follow-up appointments with your colleague, whoever was covering you when you was out of the country, though, did you, boo-boo? No, you didn't. No, you didn't. Okay, and then the disabled man's guardian had to stay on you and say, listen here, you about to be out of the country for 2 months. What he gonna do about medication? You need to get a prior authorization in. But then you had some nurse over there at Southeast. Let me tell you this, guy. Some quote nurse. She called herself a nurse. Okay, let's just say her initials are MJ. She called herself a nurse. She wasn't a bit more no damn nurse. Tried to look her up on the verification site. This heifer ain't no damn nurse. She's a liar. Sitting up here impersonating nurses. This before the motherfuckers, the 25 motherfuckers just got in trouble for the fake shit, okay? Yeah, but we went on ahead and we made sure we turned in MJ to the nursing board. We want to make sure MJ stops impersonating nurses right now, okay? Yes. So anyhow, MJ, whoever she is, like a medical assistant or something like that. But boo boo, you need to let people know your real title. You do not ever say you are RN, hunty, or LPN, boo boo, and you are not. Okay, you better go and earn that shit, boo. Okay, shut up. Okay, MJ, you better shut up. Yeah. So this heifer sits up here while the guardian is trying to get the PA for the medications, right? This bitch sits up here, honey, and calls it in. Send the damn PA over to Medicaid. Motherfucker, that ain't his primary insurance. What y'all doing over there at Southeast? Bitch. Now you just done sat up here and hindered the shit getting processed timely, motherfucker. So the guardian sat up here and called Medicare. They like, we don't have it. We don't have, the person the Medicare chose as their vendor for the pharmacy and shit. She called. She like, hey, what's going on with the PA? They said, that doctor ain't never sent that over here, okay? Okay? Because MJ's dumbass and sent it to the wrong insurance. That's what these dummies is over here doing at Southeast. Anyhow, aside from that, this fucking doctor sitting up here not letting nobody utilize the telehealth services and shit. You want to know why? It's retaliation, honey. He's discriminating against a disabled man, which that is direct violation of what HHS and DOJ told your ass, honey. They said you better watch out, okay? Because there's some federal laws and shit like that in place to protect the non-discrimination, okay, of disabled people, and that does include access to healthcare via telehealth services, okay? Anyhow, they just don't want to. They just what they want, okay? This disabled person, has a history of attacking people unprovoked, Okay? So even though they've been told 100 times that it is in the best interest of this person to participate in telehealth services, to decrease the instance that this person might attack someone in the community, like another person that might be down there seeking services or something like that, unprovoked, because it can happen, and they do know that because the doctor, remember that doctor? He's really shady and shit like that, had to be turned into the medical board. That damn doctor presented to the house one time for a face-to-face, okay? Oh, you can present to the house for face-to-face, but now all of a sudden, no, he has to come down to the facility, creating barriers and constraints and obstacles for this particular patient that already is vulnerable, okay, already has unmet social terms. It's deliberate. This person should not be a fucking doctor, okay? Well, anyway, yeah, so that patient tried to attack the doctor even unprovoked. So y'all know that he got the capability and the potential to do it, and that's what you're trying to do. Because let me let y'all know out there in the universe, anytime a patient, mental health patient or not, sits up here and attacks somebody or creates a complication where somebody feels unsafe, okay, in an environment or whatever, they can immediately drop you as a patient. They have to have a reason to drop you as a patient. You know what I'm saying? Like in this mental health type of arena, because this particular patient here would be at a true disadvantage if this doctor dropped him, right? He's on antipsychotic medications, all that. He needs monitored. But this is the thing. Why don't you want to let him do the telehealth, huh? Why don't you want to let him do the telehealth, boo-boo? Yeah, the reason why is, honey, they're under investigation by Ohio Attorney General for Medicare fraud, okay? So the guardian ended up going to the guardianship hearing with the probate court, and the magistrate just so happened that some social worker over at the damn Southeast Mental Health 16 West, what is it? Front Street. Did I say West Mountain? 16 West Front Street, Columbus, Ohio, honey, 43215, and sat up here and wrote some damn statement into the probate court, lying, sitting up here talking about she didn't think that the guardian was going to make the patient force him to take his medicine. First off, bitch, you don't force nobody to do shit unless you got an order that says you can force meds on somebody. I don't care if they got mental illness or not. You don't force them to do shit. They got rights. That's y'all's problem. You're trying to revoke people's patient rights, human rights, and civil rights, motherfucker. That's your whole damn problem. But then when somebody come along and say, hey, I'm about to speak up, I'm about to speak out, you ain't about to do this shit, then you get mad. And then you want to discriminate and retaliate and all that shit, okay? But no, we're going to let it be known, okay? And let's let it be known too, the medical board does have the awareness of this particular doctor. Okay, you know how they be doing with the corrupt motherfuckers and shit like that. They be having the awareness of the people that they give these licenses and stuff to, their colleagues, in other words. They know the wrongdoings that they're doing, but yeah, they sweep it under the rug. They don't want the public to know until, of course, when this particular doctor or something occurs at this facility, this doctor kills somebody, or this doctor hurts someone, and it becomes an issue that gets out to the public, then all of a sudden, the medical board and everybody that the guardian had complained to, or the patient themselves complained to, yeah, they're going to be like, oh my God, we had no idea. Oh my God, we didn't even know. No, they be knowing, honey. They know. They know. Yes, they do. Okay. And in this particular case right here, they absolutely know. And luckily, it's all documented just in case this doctor does end up fucking somebody up, which he's on his way to doing. Okay. He's on his way to doing for sure. Yeah. Then the person could just come on out the woodwork and be like, guess what? I let the medical board know what the bitch was doing, and they didn't do shit. They didn't give a fuck. How about that? I let everybody and their mama know. Okay. Ohio Attorney General knows that they're over there committing fraud and shit like that, billing Medicare and stuff like that for services that haven't been rendered. So anyway, that social worker, Heifer Honey, who wrote that shit down in the probate court to the magistrate, boo-boo, she didn't think the magistrate was going to say nothing. But see, ain't God good? Thank you, Jesus, okay? Okay? The magistrate was like, yeah, that. Somebody who gives him counseling services said that he shouldn't. That maybe the guardian shouldn't have, because they wouldn't make him take the meds, okay? So then the guardian had to be like, well, first of all, I wouldn't force no medication on him anyways if he didn't want to take it. I mean, it wouldn't be in his best interest, but you can't still force him. You can't violate his rights, point blank period, okay? Okay, you can't do that. But let me just let you know that no counseling services have ever been offered. They put that on their website. They put that in their grant proposals and things like that, of course. They make it seem like they're offering counseling service and therapy services, and they're billing Medicare and Medicaid as if they really are, but yet they're not. And what needs to happen is CMS, Medicare, Medicaid, and all the fraud investigators need to go, IRS and everybody and their fucking mama need to go into Southeast mental health at 16 West Front Street, Columbus, Ohio, 43215, and pull all those patient records, pull all the billing and all those claims and all that type of stuff, and do a real good comb through audit on the motherfuckers, okay? Yeah, and let's really get it unraveling and popping and popping, okay? So anyhow, yeah, this doctor is a whole piece of shit, okay? Okay, gone for 2 whole months. Won't worry about no face to face and shit. Now you want to act like you really give a fuck and you really care what's going on with this disabled man. You don't give a fuck. This disabled man don't give a damn about you either. Guess what? He only need the appointment because you make it as a requirement for him to get his damn medication for him to be stable. Okay, he is stabilized. He is doing fine. Just give him the damn telehealth appointment and call his medication and go about your fucking way. Okay, stop trying to force this man to come down there for a face-to-face appointment where you know he gonna turn out and act a fool, jump on somebody, something like that. Then you can drop him as a patient because you're really pissed off that you've been turned in for your fucking wrongdoings and your fraud and shit like that. Okay, so you don't want that patient and his advocate and his guardian, at your fucking facility. So you're coming up with some tactic or some sneak way, okay, some strategy and plan to try to not have to treat him or what the fuck ever. Nobody knows. Who knows? But the medical board got the awareness. Ohio Attorney General got the awareness too, because it's been sent over to the investigator that came here with the fraud shit to let her know as well. Like, yes, Nidra, I'm gonna let you know that these people are retaliating because, of course, this patient has reported, illegal and unethical behaviors that might potentially be going on, Nidra. So you got the awareness too, Ohio Attorney General. Nidra does. Yeah, in email, and we got copies of that too, boo-boo. Medical board, you got the awareness. Yeah, yes you do. We got copies of that too, boo-boo. So what y'all gonna do? Because now this physician that sat up here and said, oh, well, since you won't allow us to see our patient that they fucking act like they give a fuck about, right? The same doctor who got ready to call in a Abilify 5 milligram, Abilify 10 milligram, and the boy don't even take that shit. Okay, that shit was causing him seizures. This same fucking doctor don't even do medication reconciliation. He don't read a chart before he go into a telehealth visit because he don't even know who the fucking patient is. Got the wrong patient record open and shit like that. I mean, like, excuse me, doctor. I mean, are you see now? You got dementia getting ready to get started, so you are getting kind of old and everything like that. Do you even know who this boy is? I mean, what the fuck? Somebody needs to intervene before this doctor kills somebody. Okay, let this patient have a telehealth appointment so you can get a quick 10-minute, follow up. This is behavioral health. This ain't like you doing no head to toe assessment, motherfucker. You ain't got to draw no blood. You ain't got to do this. Is subjective type shit. You can take a look at him on the camera and see how he doing and talk back and forth with him and try to gauge what's going on with him subjectively and where his mental status is. That's what you can do. Okay, doctor? There's no need for you to see him down there because you know he gonna turn the fuck out, and that's what you want. They don't even have nothing to help these people get no clothes. They talking about they can take them to the fucking free store. They got a raggedy ass, dirty, string hanging out shit, doo-doo stains and everything still in and shit like that. You know what I'm saying? Fuck that. Hey, listen. Go ahead and sign up, be a patient over there at Southeast Mental Health, okay, at 16 West Front Street, Columbus, Ohio, 43215, if you want to be placed at risk, okay, if you want to be placed at risk. Or you want your insurance company billed for shit that they're not doing for you. But see, they think people with mental health issues don't have no good sense. So that's why behind the scenes they're able to do these types of things. So I just wonder how many other mental health patients have they been telling these motherfuckers at these grant places that they're actually giving them counseling services and they're doing individualized care plans and shit like that. No, they're not. They're not doing none of that. Whatever they're documenting over there is fucking fake. Okay, my son ain't got no individualized care plan, none of that bullshit. Okay, yeah. The patient I'm talking about is my damn son, okay? This is real. This is true. This is what that damn place is over there doing. And everybody and their mama know about it and they intervene and do shit.